Christopher House is a rehabilitation and skilled nursing center located at the top of Belmont Hill in Worcester. The facility offers both short-term and long-term rehabilitation and residential care, all with the hope of helping patients achieve their highest level of functioning. Joining me now is Sandra Mahoney, who's the administrator of Christopher House. Hi, Sandy. How are you?
Hi, Jen. Thanks for coming to visit us.
It's great to be here. Now, you yourself, you've been in healthcare for a long time, haven't you?
I've been a nursing home administrator more than 20 years, but I love it. I worked in healthcare in hospitals for a while, but found my love in taking care of elders. And I love being here at Christopher House.
Wow. Well, it's a beautiful facility. Now, it's been in the city for a while, right?
Well, we were built as a replacement for the former city-owned Belmont home. So we were built 22 years ago, and it was a time for a facelift, so we started with this unit. But Christopher House provides both long-term care, as you said, and short-term rehab. We have a very busy subacute unit here, and we wanted to create an environment that was more warm and welcoming. So that's what drove our renovations here. You can see we're standing in the country kitchen.
Yeah.
So we have a stove, residential style stove and refrigerator for residents and their families to use, and our staff can make a light meal for somebody if they don't like what comes from our main kitchen.
It's definitely beautiful and very homey too. And then you have areas where people can just relax and gather with the family.
Right. We'll take a look at our new lounge area. We opened up the unit so it allows residents to be within view of our staff, but still have a private place where they can sit and enjoy their family or watch TV, read a magazine or a book. So it allows folks a place to get out and about so that they're not stuck in their room when they're not involved in therapy.
It's certainly a beautiful building. And you have the other units cover, you have a dementia unit?
Right. We have two traditional long-term care units, and those are upstairs. And we also have a certified dementia unit where we take care of residents with Alzheimer's type dementia.
And you're also connected to Christopher Heights, though, too, right?
Right. We are really fortunate that although Christopher House is an independent, nonprofit organization, we are closely affiliated with the Christopher Heights. And Christopher Heights in Worcester was the first Christopher Heights that existed. It's affordable assisted living, and there are other Christopher Heights organizations across the state.
It's great. So is it like a progression? If people then need more care, they come here? Is that
right? Many folks never need our services, but if folks from Christopher Heights need to have rehab services, we are their preferred provider.
That's
so we're really fortunate, and we get folks well enough to go home and live in their apartments independently.
That's great. Well, the nice thing, like you said, you have a great rehabilitation unit for both short-term and long-term stays.
Right.
What are some of the services you offer here?
Well, we have, like most skilled nursing centers, we have a great PT, OT, and speech therapy staff. What makes us unique is we have a respiratory care staff as well. And those respiratory therapists are here 5 days a week, and they really help people with pulmonary or respiratory diseases get better quicker. So we're really proud of that. And I'd like you to talk to a couple of them. We have Diane Perkins and Nancy Foster.
Okay, why don't we do that? One of the things that makes Christopher House unique is the fact that it has a respiratory care program. Now, Diane, you've been here since that program started, right?
Correct. In 1997, I started here. I've been in the field for 40 years. It's been a great experience.
Wow, it must make you feel so good to see how far it's come, too,
yes,
right?
Definitely.
And Nancy, you also have extensive experience.
Yes, not quite as long as Diane, but 33 years in the field. So,
wow. See, everybody, they're getting the best care from you, too, for sure.
We try.
Yeah. So, Diane, just tell me who the typical patient would be.
Someone with chronic obstructive pulmonary disease. They're recovering from pneumonia. As we get older, it takes longer to recover. Think of any others?
Asthmatics. We see post-surgical patients.
Okay.
Congestive heart failure.
And this is all part of their overall care, right? The care that you give is one piece of the puzzle.
Correct.
But the nice thing is they see you every day, right? So it's really focused.
Yes.
Okay, so what would you do if a patient came in? How do you evaluate what they need?
Well, we would assess them and see exactly what kind of meds they are on, whether they're on inhalers or
Nebulizers, we always try to see how they do with their inhalers. We find just some patients don't know how to use their inhalers properly. So we always want to evaluate them when they first come in so we can get them going on the right track.
So what part of what you do must be to teach them how to use them properly, right?
Correct. And many of them have to stay on their nebulizers because they're so ill and they're not ready to go back onto an inhaler. So, and then we have various tools that we can use to help them clear their secretions.
Yeah. So the goal is by the time they go home, they're able to use all these things efficiently, right?
Exactly, and including oxygen. Many times they'll be set up in the hospital, they'll go home and they'll fail. But if they come here, we teach them how to take care of it, how to apply it, and hopefully get them off of it. And
Right.
where if they went home, that would be a much longer process.
Right. Shows how important it is to
Yes.
have you. So what are some of these things that are here?
Well, we have a variety of inhalers we've chosen for you today. A lot of times with the spacers, patients aren't familiar with the spacers, and they just are using their meter dose inhalers.
Okay.
And the problem with that is they're not using it correctly. So a lot of the times they're not getting the medication administered.
Oh,
properly.
it's just not going into the lungs?
Exactly.
Okay.
And when you add a chamber or a spacer, their med deposition is 30% more. So that's how important it is. If you're going to spend $200 plus on an inhaler, you want to do it correctly.
So we find that sometimes in the acute care facilities they don't have enough time to be taught.
Right.
So here we have plenty of time to teach them the right ways how to use the aero chambers.
Well, what a difference that can make in someone's recovery. right?
Absolutely, absolutely.
And what are some of these other?
This item here is maybe we can get someone off their oxygen during the day, but we find that their reading is too low, so we clip this on their finger and do a pulse oximetry, which measures their oxygen level all night long. And we, find out whether they do need the oxygen at night or if they pass and they can completely get off of it.
Okay. So the goal is to teach everybody how to use these effectively, and ideally when they get home, either they don't need it because you've just, right?
Right. They've
Brought
been
them
able
back.
to-
Yeah. That's terrific. All right. Well, thank you, ladies. I thank you for taking the time, and it certainly is a great benefit having you here at Christopher House.
Thank you.
Appreciate it.